perfection and catch excellence. A very good morning and greetings to the August E gathering. I, Dr. Manishita Das Mukherjee,
and I, Dr. Ravneet, with utmost delight and privilege, we welcome all the dignitaries of inaugural ceremony, deans, directors of all the institutions, all the international, national, delegates and participants, faculties, students. We welcome you to the International Conference on Biotechnological Interventions to overcome the challenges of COVID or post-COVID era, BIOCoPE 2022, organized by Amity Institute of Biotechnology, Amity University, Rajasthan. As the name itself signifies, the aim of this conference is to bring innovative minds together to discuss interventions of biotechnology in various fields. It offers an opportunity for researchers to address the key global issues and societal changes in safeguarding the humanity and environment in this unprecedented time of COVID-19. As a tradition at Amity University, we start all our endeavors after seeking blessings from the Almighty. So we begin today's program by seeking divine blessings of Mother Saraswati, the goddess of knowledge. The lighting of lamp signifies the assimilation of knowledge and blessings. So now I would request our IT team to kindly play Saraswati Vandana.
thank you for creating a heavenly ambience. We request all our dignitaries to accept our virtual greetings. We are grateful to all who have accepted our invitation to be a part of this elite event. Now I take the privilege to introduce Director AIB, Dean Research, Amity University, Rajasthan, and Convener BIOCoPE 2022, Professor Dr. Vinay Sharma, sir. Sir is associated with Amity University, Rajasthan in capacity of Dean Research and Director, Amity Institute of Biotechnology since May 2018. Earlier, he has served as Associate Professor at Department of Biotechnology at IIT Roorkee and later as Professor and Head, Department of Bioscience and Biotechnology, Dean, Faculty of Science and Technology at Vanasthali Vidyapeeth. He has been honored with many prestigious fellowships and awards in India and abroad. To mention a few, Professor Sharma is a Fellow of National Academy of Sciences, Fellow of Biotech Research Society, Fellow, the Indian Society of Genetics, Biotechnology Research and Development, and the Fellow of Indian Botanical Society. He was honored with Distinguished Scientist Award and later H.S. Srivastav Memorial Award by Society for Plant Research. Earlier, he was awarded Zarur Qasim Gold Medal by Society of Biosciences, Young Scientist Award by Indian Science Congress Association, and has been a member of the New York Academy of Sciences. Professor Sharma had extensive international research experience as visiting scientist professor at many institutions like Institute of Botany, University of Cologne, Max Planck Institute, Cologne Technical University, Darmstadt, Germany, University of Central Florida, USA, Institute of Bioresources, Okayama, Japan, Shanghai Polytechnic University, China. He visited Germany and later to Hungary under the prestigious INSA bilateral exchange program and has been a DART fellow too. Sir has chaired sessions and delivered over 120 invited inaugural lead lectures in various symposia and conferences in India and abroad, which includes Spain, Portugal, UK, Italy, China, Japan, USA, Hungary, and Germany. His broad research area is plant stress biology, molecular plant physiology, plant biotechnology, and bioinformatics. He has published 360 research papers with an H index of 36 and ITEN index of 110 with over 4,300 citations. He has authored 8 books and is on the editorial board of several journals. He has mentored 75 doctoral students under his supervision who are all well placed and employed either as faculty members in Indian and foreign universities or as working in industries. In addition to his impeccable research and teaching skills, Sir has rich administrative experience over 26 years as department chair, biotechnology and biosciences, and 22 years as dean in various capacities. Overall, Sir combines the qualities of a great researcher, teacher, administrator, communicator, motivator, and advisor. Currently, he is mentoring several young scientists for innovative research at Amity University, Rajasthan. With these few introductory words, I would request Professor Vinay Sharma, sir, to present his welcome address. Over to you, sir. Sir, you're muted.
Thank you so much, Dr. Manishta, for this very, very generous introduction. Chief guest of this inaugural session, Padam Bhushan Professor N.K. Ganguly, former Director General, Indian Council of Medical Research, and visiting Professor of Eminence, Policy Center for Biomedical Research, Translational Health Science and Technology Institute, Faridabad. Guest of honor and keynote speaker, Professor Syed E. Hasnain, Honorary Professor and National Science Chair, Science and Engineering Research Board, IIT Delhi. Our second keynote speaker and guest of honor, who will join shortly, Dr. Sanjay Singh, Chief Executive Officer and whole-time Director, Genova Pharmaceuticals Limited, Bhosali, Pune. Honorable Vice Chancellor, Professor Dr. Rakesh Patnagar, Pro-Vice Chancellor, Professor Amit Jain, distinguished keynote and invited speakers, distinguished international and national delegates, participants, and invitees, deans and directors, and our brilliant and highly talented students of MIT Universe. Very hearty good morning and hearty pranams to all of you. I'm absolutely delighted to welcome you all on the occasion of this international conference on biotechnological interventions to overcome the challenges of COVID, post-COVID era. Honestly, I am deeply honored to share this platform with a galaxy of highly eminent dignitaries. The last 2 years have seen major disruptions and emerging new challenges in our life and the surroundings due to COVID-19, which is still continuous. In this unprecedented COVID-19 crisis, which is filled with volatility, uncertainty, complexity, and ambiguity, our Chancellor, Dr. Aseem Chauhan, has led the way and provided valuable tips and guidance to the venture capitalists and the entrepreneurs in his book, VUCA in Startups. Biotechnology scientists also rose to meet these challenges with new innovations, and the biggest we all know, being the development of new vaccines, which were made commercially available within a short span of about a year due to concerted, focalized, and sustained efforts by the scientific community. A process which otherwise took many, many years, generally a decade to about decade and a half. So this, in fact, itself is a great, innovation and rising to meet the COVID-19 challenge. We were prompted to organize this international conference to collate various biotechnological efforts made in different disciplines in microbial biotechnology, waste management, medical and pharmaceutical biotechnology, food and agricultural biotechnology, energy and environmental biotechnology, plant biotechnology, and plant therapeutics and the related industries to address the key global issues and societal challenges in safeguarding the humanity and environment and to meet the future challenges in these unprecedented times of COVID-19. I'm absolutely delighted to inform you that the response to the conference has indeed been overwhelming. Within a short span, we have 425 researchers who are registered, including foreign delegates from USA, UK, South Korea, Finland, China, Cameroon, Saudi Arabia, Fiji, and Pakistan. Within India, we have participation of the delegates across all over. It's a pleasure for me to call the names of the states: J&K, Kerala, Karnataka, Tamil Nadu, Andhra Pradesh, Maharashtra, Odisha, UP, MP, HP, Bihar, Delhi, Haryana, Rajasthan, Assam, West Bengal, Punjab, and Gujarat. So all parts of India, right from top north to deep south and from east to west. After a peer review, selected presentations shall be published as full research papers in a special volume of Vegetos, which is of course a Springer Nature and a Scopus indexed journal. Amity University is India's leading research and innovation-driven private university with 11 campuses in India. Strong in research, there are 400 plus projects, 25,000 plus publications, 1,500 plus patents. I must proudly share that the Union Ministry of Commerce and Industry conferred the award for the top Indian academic institution for patents and commercialization on Amity University, which was received by our founder president during the National Intellectual Property Award 2020 in a virtual event which was held on 17th August 2021. Amity University Rajasthan is set in lush green and eco-friendly environment with a campus of 152 acres, with a vision to be a global university and provide value-based contemporary education blended with modernity and tradition. The AUR offers its students a campus for their integrated development and is marching towards the new pinnacles of academic excellence. AUR is fully furnished and high-tech institution and offers the students sophisticated laboratories with the state-of-the-art infrastructure in various disciplines, with over 225 experienced faculties and 13 established institutes. Only recently, AUR was one among the only 4 universities all over India which was sanctioned the prestigious DST PERS program with a financial support of 8.5 crores. This recognition itself speaks volumes about the quality of research which is being currently pursued at Amity University, Rajasthan. In this overall background, and with such a distinguished gathering of eminent scientists, as well as the young innovative minds who are striving to make their mark in the scientific world, I have absolutely no doubt that BIOCoPE 2022 would surely result in important deliberations, new ideas, and networking for future collaborations. Once again, a hearty welcome to you all, and thank you.
Thank you, sir, for extending a warm welcome to all of us present here. Now, I take the privilege to introduce our Honorable Pro Vice Chancellor, Amity University, Rajasthan, and Patron BIOCoPE 2022, Professor Dr. Amit Jain. Professor Dr. Amit Jain is currently Pro Vice Chancellor at Amity University, Rajasthan. Prior to this, Professor Jain was Director, International Collaborations and Professor TAPMI School of Business at Manipal University. Professor Amit has been a visiting professor with the University of Technology, Sydney, Australia, Zecni Estvan University, Hungary, and Celia Janos University, Slovakia. Professor Amit holds a PhD from Sardar Patel University and has also completed FDP from IIM Ahmedabad. Professor Amit has designed and conducted training programs and sessions for executives at various organizations, including IGBI Bank, Bank of Baroda, BKT Tires, JK Tire, JK Lakshmi Cement, Claris Life Sciences, Vida Clinical Research, Natraj Foods, Trimurti Food Tech, Euro India Foods, Penna India, Gravita India, Patanjali, etc., to name a few. He has several publications to his credit and has also presented research papers at national and international conferences. His professional associations include Life Membership of Indian Society for Training and Development and is currently National Council member. Dr. Amit is editorial board member of Indian Journal of Training and Development. He is also the chief editor of Amity Management Review. His area of interest is research, training, and consultancy, which also includes marketing strategy, sales management, digital marketing, marketing communications, retail management, and entrepreneurship. So now, with these few words, I request our Honorable Pro Vice Chancellor and Patron for BIOCoPE 2022, Professor Amit Jain, to deliver his address.
Thank you so much, Dr. Ravneet. With the blessings of our Honorable Founder President, Dr. Ashok Chauhan, with the blessings of our Honorable Chancellor, Dr. Aseem Chauhan, and Honorable Vice Chancellor, Professor Rakesh Bhatnagar, I feel honored and privileged being given this opportunity to express my gratitude and extend a very warm welcome to all the guests and the participants of this August gathering of this wonderful conference that is being organized on March 24 and 25. I extend my gratitude and I welcome our chief guest for the occasion, Professor Nirmal Kumar Ganguly. Sir, your contribution to the field is known to everyone, and you are a stalwart who has taken India's research and science to the world. I'm privileged to welcome our guest of honor, Professor Syed A. Hasnan. A very warm welcome, sir, to you. I'm privileged to welcome our another guest of honor and keynote speaker, Dr. Sanjay Singh, Chief Executive Officer and Full-Time Director, Genova Biopharmaceuticals Limited. A very warm welcome to all the deans, directors, vice chancellors of all Amity universities across the globe. Very proud to share that we have now 12 universities in India and 17 overseas campuses. And as Dr. Sharma also shared, that Amity being a family of 175,000 students at a given point of time and 6,000 plus faculty members and scientists is no doubt one of the most global and one of the largest education groups in the country. So I extend a very warm welcome to all the esteemed vice chancellors of all Amity institutions who have joined. A very warm welcome and greetings to all the deans and directors of Amity University, Rajasthan, all faculty colleagues and the organizing team of BIOCoPE. A very warm welcome to all the paper presenters and all the participants. I'm sure the deliberations will benefit the student community at large and will bring out the cutting edge research to fight this COVID or COVID related pandemic. In fact, what biotechnology has done, uh, during this time is unprecedented. And as we discussed and we have been talking about it, that development of a vaccine in a year's time is a miracle, which was not seen earlier. But yes, our scientists are able experts could do that. And that is something which is wonderful and a great contribution to humanity. Similarly, Amity Education Group also believes in a philosophy where we try to blend the modernity with tradition. And Amity is into the entire education universe. So from pre-nursery schools called as AMI-OWN to the K-12 schools, international schools, UG, PG, PhD, postdoctoral program. We are into distance and online education. We are very active in corporate trainings. I come from training and management background, and we try our level best to help people with continuing education, to help them update and keep abreast with the latest trends in the industry and serve the economy. We also believe, on three principles, which is values and ethics, nation building, and holistic education. And that's why there are some very unique features which I would like to share here. And for the benefit of our invited guests, many of them have also visited our campus, which can be seen in my backdrop. But probably Amity is the only university where we have a foreign language which is compulsory, and we give multiple options to them, typically French, German, Spanish, Mandarin, Chinese. Amity is the only university where a 7-day military training camp is mandatory for all the students. And the idea is, as I said, our philosophy of values and ethics, nation building, and holistic education. So students not only learn confined in the four walls of the classroom, but they learn going out in the field, they learn through live projects, they learn through simulations, they learn through case studies. We subscribe to Howard Research case studies, we subscribe to best of the online resources also. And all this is giving a cutting edge to all our graduates. Every METN undergoes a special course on behavioral science. So a behavioral science course is compulsory throughout the program. Similarly, we have a lot of emphasis and focus on building communication skills of our student, and a communication skill module is also mandatory for all. So these are some of the best practices that we have derived from our international experience and our international exposure, as well as going back to the roots of Indian culture. We do believe in a lot of outbound learning. We do believe in a lot of practical learning, and the contribution made by METNs in R&D of the country, be it through the funded projects that we are doing. Dr. Sharma shared about 400 odd projects as of now going under Amity Universe mentorship. We are partnering with best of the government institutions to carry on with their research agenda. And we are trying to link our research with the society. Science and technology and research has potential to transform the lives of individuals, of society, of the country. But when these research endeavors are linked with the social good, the outcome is more fruitful and the results are much better. So with these few words, I'm probably the least educated to talk about biotechnology or biomedical sciences or biosciences at this forum. But I'm so happy to see the kind of conference that has been curated by Dr. Vinay Sharma and his able team. I could see the various sessions that are going to talk about medical and pharmaceutical biotechnology, food and agriculture biotechnology, energy and environment. So what I feel that biotechnology today is touching each and every aspect of our life. I often vouch for digitalization. I often vouch for use of technology in education, but biotechnology adds even more value to that, because the technology is added and supported by biology, which is the basic constitution of each one of us. So biotechnology and plant therapeutics, we are going to talk about. There are sessions specifically invited talks on sustainable and eco-friendly housing, landscape. So I feel it covers the entire spectrum, and the outcome is going to be wonderful. My good wishes to all the participants and paper presenters. Thank you so much, Dr. Ravi. Over to you.
Thank you so much, sir. Ladies and gentlemen, I now take the privilege to introduce our Honorable Vice Chancellor, Professor Rakesh Bhatnagar, sir. Sir is also the patron for BIOCoPE 2022. Sir is the former Vice Chancellor of Banaras Hindu University, Vice Chancellor of Kumayu University, Nainital, Professor in School of Biotechnology, Jawaharlal Nehru University, New Delhi. Sir has pioneered the teaching and research in biotechnology at JNU, the first of its kind in the country. He is well known for developing recombinant vaccine against anthrax, the technology of which has been transferred to the industry. The vaccine has successfully completed phase 1 and phase 2 trials, as well as the human clinical trials. One of the significant contributions in the field of research and innovation has been the development of drug-resistant TB diagnostics in collaboration with one of the topmost diagnostic companies. Sir's research has been ranked 7 in the anthrax research globally. The first 6 were from Pasteur Institute, Harvard Medical School, NIH, and USA MRIID. Sir has more than 185 research papers to his credit, which has received more than 5,000 citations, and he has an H index of 39. He has supervised more than 50 PhD students and more than 100 master's students. Sir is an elected fellow of all 3 major science academies of India. With these few introductory words, I would request Professor Rakesh Bhatnagar, sir, to address the gathering. Sir, over to you, please.
Good morning. Professor N.K. Ganguly, my mentor when I came back from Germany and joined PGI Chandigarh. My great friend, Professor Hasnain, I still remember when I returned from US, he was the only one whom I could go and ask for any information which will help me to make my transition easier in India. He was working in my neighboring institute, National Institute of Immunology at that time. Dr. Sanjay Singh, who is running a very successful company, Genova, in Pune. He is one of the youngest, I would say, technocrat who, with the passion of doing something in India, returned from United States and came to India to make biotechnology. And the history goes back to mid-80s, when many of us were trying to return to India. Thanks to Government of India, Department of Biotechnology, they thought, let us say 35 years before from now, that biotechnology has a future. And we all returned to India to start doing teaching and research in biotechnology. Today, when we are talking about that during COVID time, how quickly we have developed the technology to make the vaccine, to make the diagnostics, to make even PPEs and masks so quickly. It was not without the, right decision taken by Government of India to initiate teaching of biotechnology and research in biotechnology with very generous funding. We still remember when we returned, there was no course being taught in biotechnology in India, and JNU, along with few universities, we initiated the first course in biotechnology. And that is the reason today biotechnology manpower is available in the country to serve the industry. And that is why our industry could make these vaccines so quickly. They could make diagnostics so cheaper in the country. I still remember when COVID pandemic started, it used to cost something like 4,000, and which was not affordable. And today you can go and get it done in maybe 300 rupees in any hospital of your choice. So therefore, I would say that biotechnological intervention, which is the theme of this conference, is very timely. And I have a great belief that COVID has given us something like a training how to develop biotechnology products so easily in such a short time. And I'm sure that government agencies will take note of it and make the procedures more industry friendly, more business friendly, more research friendly, so that we don't have to look for technology coming from abroad. For example, Bharat Biotech, I think it is a very young company, and I still remember a few of my students, they were working over there, and now of course they have gone abroad. But they were the people, Indian industry. Some of them worked in Shanta Biotech, some of them worked in Panacea Biotech. So all these young biotech companies, which are not very old, maybe 30, 40 years old companies, today they have the confidence to develop any biotech product in shortest possible time. Another thing which has become very obvious, and today is the newspaper knowledge, that 70% of the vaccines of the world are produced in India. It is something like, India is becoming not only IT capital of the world, it is also becoming vaccine production capital of the world. So this conference is very timely. So I welcome all my guests, all my speakers, all the people who are attending online or offline. And I'm sure the theme of the conference is very vast, including medical biotechnology, agriculture biotechnology, energy, etc. So as my PVC told, that today biotechnology is touching every sphere of our life. I'm sure this conference is going to make our students more knowledgeable, and they will become more enthusiastic to work and try to solve the problems in an eco-friendly manner using the tools of biotechnology. With these words, I thank each one of them who is joining this conference, and hope that this conference will certainly make us more knowledgeable, and we will be more ready to make newer and newer biotechnology products which can solve problems of the society. With these words, I thank you very much for joining the meeting. Thank you.
Thank you so much, sir, for your address. Ladies and gentlemen, we have the proud privilege of having Honorable Founder President Sir amongst us today, Dr. Ashok K. Chauhan. Sir is also the chief patron of BIOCoPE 2022. A stellar support system makes achieving goals much easier. I take the privilege to express gratitude to our Honorable Founder President, Sir, RBEF and Chairman, AKC Group of Companies, Dr. Ashok K. Chauhan, sir. Sir, a larger-than-life icon is continuously creating history and setting new and higher benchmarks by conceptualizing, modernizing, and developing initiatives to promote amity with a belief that one should not follow where the path may lead. Instead, go where no path exists and leave a trail behind. Ladies and gentlemen, just to provide you with a small example of our founder president setting an example and how he raises the bar to motivate us to achieve the extra, I would like to share that our founder president, sir, as a usual practice, works with 3 laptops on his table and works simultaneously with multiple teams. Our founder president finds enrichment simultaneously from 3 or 4 valuable ongoing programs and also the opportunity to hold his meeting and do telecons. With these few words, I would like to request our founder president, sir, to please address the gathering. Sir, please.
Yeah. In fact, Dr. Manishita, I must add here that Honorable Founder is currently also attending this particular event with multiple meetings, and he has sent his special remarks and his blessings for success of this conference. Probably if he gets free, he'll be able to address us also for some time, but he's very much with us. His blessings are always with us, and he is in fact currently attending this particular session and giving his valuable advice offline. Thank you so much.
Thank you, sir.
So now it's the time to introduce the icon we all look up to draw inspiration. So I now welcome our respected chief guest, Padam Bhushan Professor Nirmal Kumar Ganguly, former Director General, visiting Professor of Eminence, Policy Center for Biomedical Research, Translational Health, Science and Technology, Institute Faridabad. His current affiliations also include Honorary Senior Research Professor at Institute of Liver and Biliary Sciences, New Delhi, Professor at the Gangaram Institute for Postgraduate Medical Education and Research, Sri Gangaram Hospital, New Delhi. He is also the Senior Scientific Advisor, Global Health Strategies. He is also the President of Apollo Hospitals Educational and Research Foundation, Immunology Foundation of India, Gut Microbiota and Probiotic Science Foundation. He is also the Emeritus Professor at 2 reputed institutions, including Postgraduate Institute of Medical Education and Research and Legal and National Academy of Medical Sciences, New Delhi. He is also the Distinguished Professor at SRM University, Sonipat, Haryana. Professor Nirmal Kumar Ganguly is a former Director General, Indian Council of Medical Research. He was formerly President of the Jawaharlal Institute of Postgraduate Medical Education and Research, as well as that of the Asian Institute of Public Health, Bhubaneswar, Odisha, New Delhi. Former Director, PGIMER, Chandigarh, and former Director, National Institute of Biologicals, Noida. He has been the General President, Indian Science Congress Association, 2004-5, and former President, National Academy of Medical Sciences, New Delhi. He has recently been appointed as Commissioner, Lancet Commission for Intervention of Disease Transmitted Viral Diseases since February 2019, and as a member advisory board, Post Polio World, supported by Sanofi Pasteur since 2019. Professor Ganguly has done his MBBS from R.J. Kar Medical College, Calcutta University.
Thank you. Thank you very much, Professor Bhatnagar, Professor Jain, Professor Sharma, Professor Hasnan, and Sanjay Singh, and all other distinguished guests in this audience. I will, today is the World TB Day, and it is being celebrated in Vigyan Bhavan just now in India. I thought that I take this matrix and say and see that how the innovation and the biotechnology development has helped us in moving forward and where we are stuck at this given moment. Because science, I will confess with you, I have asked every secretary of Department of Biotechnology. I was the professor, district professor, Department of Biotechnology. And when I was appointed, I said that please explain what is biotechnology. Nobody could give a definition of biotechnology. Modern biology, when it is applied to different uses, it becomes biotechnology. But we don't use modern biology as, and a lot of other branches of modern biology, systems biology, synthetic biology, a huge amount of things constitute genomic sciences, proteomic sciences, the metabolomes, all of these things become part of the this so-called science of biotechnology. So it's a very vibrant science, and this actually need to be understood. And some very basic things which I was little weak in mathematics, so I went to biology. And mathematics never left me. Wherever I went, it never left me ever. So when I went to Japan, I was in a department which has discovered 4 complement fractions, the proteins and hemoglobin M. So all the reactions had to be calculated. And so they gave me an abacus because that at that time only sine rules and abacus were available. These calculators were not there at that time. So, and I give you one example. I have a nephew who was older to me. His name was Kalyan Banerjee. He was a professor of mathematics in IIT Kanpur. And he was taken by Vijay Raghavan to National Biological Science Institute to teach mathematics to biology. So this what we need, since Amity is becoming a very big brand name now in education as well as research and technology development, it should comprehensively look at and innovate in the education. When I was a student in Lucknow University doing my chemistry BSc, it was compulsory that we pass a paper on English. So they visualized that humanities is also very important in the science. So they had introduced that subject over there. And when I went to do my MBBS in Calcutta University in the first year, which is not there in any other medical colleges, the chemistry was one of the papers. So the science silos are totally disappearing. So when I look at a product of BSc, so-called BSc Biotechnology, I sometimes lose sleep in my mind, and many of them come for training to some of my laboratories where I work. And I find the foundation is so weak because some of the very strong foundation sciences, they have not run or gone through in their course. So only then they will. So we need to create a good product. So I will start with this because many of the students are listening to this talk. So even if it is not in their curriculum, they should make it important that they learn these. Even when those who are doctors who are measuring blood flow or measuring pressures in the liver. They have to use all kinds of science and scientific things in their studies. So let us come to the tuberculosis. Whenever we come to Dr. Hasnan is here, his research was in the tuberculosis. I was previously thinking I speak something in coronavirus, but even the grandmothers know much more about coronavirus than us. So every day they are listening to 5 speakers on the TV with all the channels, and they have become all experts now. So I thought that I speak on TV, which is a forgotten subject. Actually, the world burden, India and China, they take up about 75% of the total burden of tuberculosis globally. And it's a misery. In India, after a very concerted program, it fell by 50%, but now then it plateaued. It really didn't move further. TB is a very miserable disease. It affects poorest of poor, or those who are going through immunosuppression or going through treatments like TNF alpha, etc., or tocilizumab or things like that. But essentially, it's a disease of the poor, and again, it is a disease of the children. But about 15% of all the population of children and adolescents, which is 15 to 20% of the total world population, suffer from tuberculosis. And out of 1 million or 1.5 million cases every year, the death rate is very high. 225,000 die with that. So with this kind of a thing, previously, we used to take them to a sanatorium, and then they waited till they got the naturally cured or died. Now they live in very worse situation. We have urban slums, we have urban poor, we have 10 people living in one particular room. So this is very, very bad situation in our communities, and many of the our cattle population, which sometimes we aggregate in the West. If your cattle has got tuberculosis, it will be culled. In India, if you even try to do that, you yourself will be culled. So it is not only bovine tuberculosis they suffer also from human tuberculosis. They also suffer from this garden. There's a new one which came up with the Vivek Kapoor's work from the
state.
US. This came up as a major new bug. So there are a lot of sources from which we get this particular thing. The problem has been that there were almost handful of drugs which you had to take. If you didn't take multiple drugs, and many of those drugs were toxic. There is no tuberculosis drug which doesn't have toxicity. So these drugs, one of the major thing came, which was to enhance compliance, that these drugs were now made into satchels. So AKT1, AKT2, AKT3, AKT4, in this way, the number of combinations of drugs were made in a satchel, so that we enhance compliance. But then one of the things which Michi-san and others did, that they started a DOTS program, that is a direct observation treatment, because people didn't used to take these drugs, they used to run away. So the DOTS program was, people claim that it was discovered in India, and there are some disputes. People say that no, it started in Africa, but essentially it started in India. I mean, I went through everything, but India sometimes publishes later on. So the publication was a little late, but it was discovered in India and instituted in India. So DOTS program improved the compliance, but even then all tuberculosis patients, they they get reaction. About 16 to 30% of them get reaction. So they run away from the treatment. And that one thing which DOTS program did, that it reduced resistance to tuberculosis. So it was less than 2% primary resistance, ultimately the current status. However, since they run away from the treatment and treatment becomes incomplete, acquired resistance is very high and it is alarming. So we have two varieties of the resistance, which at the moment are alarming. One is the multi-drug resistance, and when you have multi-drug resistance, then your treatment becomes 100-fold more. So if you, right in the beginning, if you could find out that if it is multi-drug resistance, treatment cost decreases. But if you then there was a extreme drug resistance and total drug resistance. Total drug resistance is a death sentence because you really don't have anything which will work in that particular subject. And unluckily, in the NIH, previously this was run by Francis Collins. They have rooms in which you can even treat a TDR subject. There is nothing, not even the air, anything will not go out and come out of that room, which gets treated, and all the people who are taking care are protected. But we don't have any facility like that in the US, etc. They have some facilities of treating such subjects, even the Ebolas. So then came the issue that how do we diagnose? Because you have to give so the microbiological diagnosis, not the radiological diagnosis. Microbiological diagnosis was the hallmark of the diagnosing it. So you have to see slides 13 times transversely, 13 times vertically to give a positive negative label. And there was eye fatigue, and only 30 to 40, the best laboratories could do 30 to 40%. So here comes the innovation, and that is where that is the main subject. That was only background. So innovation, one thing became very important, that the TB samples, the sputum which was taken out was very thick of protein. And it was not really, when you made smears with that, you got negatives, and because many times the bacteria got trapped. So Dr. Narayanan and Dr. Tyagi, Mrs. Tyagi, they developed a system, and later on Balamanian also developed a system wherein with they created a cocktail with L-acetylcysteine as well as some beads which will trap mycobacteria. It gets concentrated. It is very easy, and it was introduced in our system in some way or other. Then came the so when you have dealt with the sample, then the other things which come is the microscope. Microscope was the bedrock of things. So one of the things which was innovated in the microscope, that if you had an LED light, you could you improved it. But problem was that you used a oil immersion lens, and oil immersion lens got spoiled because it was not clean, not maintained. It got spoiled. So there was an innovation that used a high power lens which doesn't touches the slides, and then you know that Mycobacteria hominis is a beaded substance. It is not a stocky thick bacteria. So they use the flow cytometry method, and in this flow cytometry method, what happens that the particles are gated through scatter. So the thick one and the beaded one will have a different scatter, and they will get gated differently. So this was done by innovation. They in United States, TSA ordered a Indian company to develop a system which will detect explosives. But then there were better methods which were developed, and they withdrew their order. So these guys then created this particular thing to the tuberculosis. And then you got in the screen, you got the bacteria and you touch them, and they became visible, and then you could really use automate it, use a lot of cassettes and slides. And these days there is a program known as Lakshya, where the report need to go very quickly. So it went there. So this then became a very good innovation. The Princeton, a student in Princeton made it very cheaper. That was another innovation. However, in India, this is not being used at the moment. So this innovation will change the scape. But even if we have a product, it is not really, it doesn't guarantee that product will be used. The next innovation in that became in the fingerprinting of the mycobacteria. So because mycobacteria, each mycobacteria has an identity. So they were fingerprinted by Meru VNTR. They were fingerprinted with this polygotyping, deligotyping. Essentially 16S RNA was typed. But the copy number in Indian strain was very, very small. So very, very low. So many times mishaps happened there till this NGS and sequencing came up. The sequencing really changed the scenario of everything. And in India, it was now with the COVID, some or other, the sequencing scenario has changed. Otherwise, it was in the hands of some elite, and they also did the full sequencing. And the Broad Institute, I brought in with a great difficulty and great opposition of the Indian scientist communities, who are so wise with wisdom that sometimes they take decisions which will be beneficial for India. So Indian scientists in the bureaucratic realm, they thought that this is not really necessary. So however, Soumya was at that time TRC director. I prevailed on her, and the Broad Institute and us, Broad Institute and India, they sequenced around 1,000 strains, and they found a lot of meaning. And the East Delhi type was the permanent type, but the Beijing type had come, and a lot of Beijing strains have, Beijing motifs have gone into this. This actually changed this, and we could track them around globally. So this was something very, very good. And then came point of care diagnosis by the CFID. I was a member of the Grand Challenge of Bill Melinda Gates Foundation. And there, this was observed that why don't we have point of care tests, which will use. So CFID was awarded this, and CFID, the originator of the CFID one now lives in California, and that particular thing changed it. And Gates Foundation brought Peter Small, and Peter Small did a validation, and they rammed it down the throat of Indian system by providing 1,000 or 1,500 machines, which was put up everywhere, and ultimately it was used. So again, this was an innovation. It made point of care very close, but these were expensive. The same was the BioFire, Alair, so many other things came up till still a test using LAMP technology, which is isothermic, came up. And there was a company known as Human Japanese Technology that India started making it. But when India made it, and WHO actually made a recommendation that it could replace the microscopic test and could be used for that. It got evaluated globally. And then when it came to India, Indian bureaucratic system did a very nice thing. It went on and on saying that you do this. And when they came back, they said, you do this again the same way. And somehow it hasn't got into it. It is there in the private market. It didn't go to the program. So this is very important that if you have a product, it need to be used and it need to go to the program. So there is the same way there are 5 water technologies which doesn't cost a penny. India, they were validated in India. India doesn't use it. So, there is a triangle of Anna Fletcher. She was the vice president of Puerto Rico. The top is generating knowledge. After that, the knowledge management. Third is the translation. And final is that the community should demand this particular product, or the politician should realize that this is important so that it is funded, and the bureaucrats, scientific bureaucrats, who listen to, who follow a system, they agree to that. But then there is an in-between arena where comes the behavioral scientists and social scientists and NGOs. They actually reach the people. And that is the lacking thing. So all of these innovations haven't, Dr. Hasnain also has developed a test system for Mycobacteria quick diagnosis. I wish him all the luck in the world so that he is able to get it into the system and it is used in the system. And while he's doing it, he will realize how difficult it is. And many times one time I know he had to fight with DCGI to get it through. So these are some of the things. I will end by saying that few new developments which have occurred in the area of, in the diagnosis, we don't have diagnostics in the for the children. There was a scientist who is no more, Dr. Gaur, in Dr. Bhatnagar was mentor of Dr. Gaur. He had developed a breath test, but then nobody really took it over for the final development so that it could ultimately be used. Perhaps it could have been an answer to many of the other things. And the LCMS system, Multitoph, is very widely available now, where you have a difficulty because it's difficult to develop all the mycobacteria, the avian complex or Kansai or Fortuitum and others which can cause disease. And the Multitoph could be used as a reference material because all tests need to be now centrally reported. So there is a possibility of doing things better. So in the drugs arena, there are a huge number there. When you go to the pharmacogenomics, Indians are very peculiar. They don't really, 30% of them, they don't metabolize the drug properly. And so the rifampicin, which is to be given 450 milligram, sometimes you have to increase to 600, sometimes you have to increase it to 800, and sometimes you have to increase it to 1,200 milligram. So this is something which is very problematic. And when the mothers are given this, when the babies suck the milk, they shut off the gene. So there is a huge issue over there. So pharmacogenomics is another thing which should be constantly used. And in the drug development, that particular part needs to be done. The recent development of bedlaquine has been a very major development. And now bedlaquine in India, it is used, but it is used not in a real programmatic manner. It is used in very, very succinct manner. It is not there, but it is coming up as a primary intervention now in many parts of the world. And dinozolid, which was used in some circumstances in the dot plus, there's sulzolid, which could be used in children very, very well. There are two other drugs which have developed, and some drugs failed, like Bal Ganesh's drug failed. There was TB Drug Alliance, another drug which we put in trial in India, but Samir Brahmachari was getting it done. It also failed. So there are failure rates also, but there are some good news that we have some drugs which is going to work. In the vaccine front, the Kaufman's vaccine is being tried by, I do not have time now, so I will like to finish. It is being made in Serum Institute, but I don't know when it will see the time of day. There were several major developments in vaccine front. The Anil Tyagi and group developed a prototype, and there were two other prototypes which were developed. They were Indian development. There are some very good immunologic markers. At the moment, we don't have a correlate of protection, but some immunologic markers help towards that direction were also available. Bovine tuberculosis, now there is a program to inject them with the BCG, because in India, as I have described the problem, this has been done in South Africa. Indian BCG program in bovine tuberculosis stopped. Why it stopped, I do not know. So only thing I wish I have found scientific community is the major enemy of science in India. Every scientist, there is a saying that gather 3 Bengalis and there'll be 3 parties, and gather 6 scientists and you will find 6 opinions. So scientific community need to come together, develop evidence-based decisions, and with these decisions, they need to really help our political systems and others, and involve the communities in your decision making, involve the social scientists, the anthropologists, etc. in your decision making. And when you develop a product, see that industry will take it. Most of our industry actually buy technologies from outside. They are not taking from our academic institute mostly. I will not say it is an absolute term. In engineering, in other areas, they are taking. In biology, it is happening less and less. So all biologies unite, and Amity University, I wish all the best. Whatever I'm seeing in the Amity University complex is very, very rewarding. It is in the initial stages, I was thinking whether it will really be brand ambassador or not for the education and research and technology development. I find it is moving towards that direction. So all the best, Dr. Bhatnagar. Thank you very much for inviting me. Sorry if I've taken a little more time. Thank you.
Thank you.
Thank you so much, sir. Thank you for your address. We welcome Professor Kamal Kant Dwivedi, sir, presently holding the position of Senior Vice President with Ritnan Baldev Education Foundation, Amity University, Noida. Sir, a warm welcome to you, sir.
As Dr. Sanjay Singh is having meeting, so first now I would like to introduce our next guest of honor and speaker, Dr. Sanjay Singh. Dr. Sanjay Singh is the Chief Executive Officer, Genova Biopharmaceuticals Limited, a subsidiary of MCure Pharmaceuticals. He has been associated with Genova since 2006. At Genova, his scientific expertise has led to several innovations to treat life-threatening diseases, and Dr. Singh has also been at the forefront for developing India's first remarkable mRNA vaccine for COVID-19. Prior to joining Genova, he worked with the National Institute of Health, USA, where he headed the antigen research section. He has won numerous awards from the US Department of Human and Health Services, some of which include Special Act or Service Award in 2005 and Staff Recognition Award NIAIT NIIH in 2004. Dr. Singh completed his graduation and post-graduation in science, that is biochemistry, from the Lucknow University, and is a PhD in the biochemistry from the Central Drug Research Institute, Lucknow. So I would now request Honorable Dr. Sanjay Singh to address the audience.
Thank you very much. And sorry, Professor Hasnain, I have jumped in because I have to run away for a meeting. And so thanks for inviting and everybody who is here. Professor Ganguly is a mentor for life. And Dr. Bhatnagar, we have very good memories from ICGV days. And Dr. Hasnain, I used to visit his lab when I was working at ICGV. And because many of my colleagues came from his lab at NII. So thank you for inviting me. And I want to take this opportunity to little bit talk what broadly we are doing, where it is going, because it is like post-COVID thing. So I'm just sharing my screen. So is I visible? My screen is visible?
Yeah. Yes, sir. Yes. Sir.
So basically, when I was supposed to choose and make a decision between which subject I should go, so I decided to do the biology, though most of the family members are physicists. And because I always believe that biology is the new era after physics where it is going to make a difference. with huge development in the science, the real difference which came into the biology, or now we can say, as Professor Ganguly was saying, biotechnology, by human genome or genome sciences, because we know what are the most of the proteins works, how they work. And certainly India has a huge impact in the world in the biotechnology, because at present, certainly most of our requirements we can fulfill by ourselves. And that is, credit should be given to Department of Biotechnology, to our thought leaders who decided so early to do it and go ahead. And India is a hub for pharmacy, where most of the medicines, generic medicines, are produced. But I think the next generation is started, where MIT University or these kind of things have started coming. And as my kind of people also who are hardcore scientists in the lab decided to go into entrepreneurship. But this path of innovation is not easy. It takes decades to crystallize things and take it forward from lab to the clinic. So here I would like to introduce a little bit about the new platform, and for the students are there. So I want to present them that how we are thinking this direction and what we are doing. So very simple, I would like to say that when this COVID vaccine came and what is the advantage of the nation's power, there are different vaccine platforms available. So vaccine one, as the Bharat Biotech, Dr. Ella, his team, they develop it very quickly, the vaccine, and which vaccine has been approved and is in the market. But this platform is like the master of the platforms, which started very early, maybe 90 years ago. And today also this platform is available, where polio, hepatitis, influenza, yellow fever, these vaccines are in the market. But as science has started improving, these platforms are also improving. And then this platform from whole viron, it has moved to the recombinant vaccine platform. And from recombinant vaccine, we can say hepatitis B was one of the biggest example came, seasonal influenza, HPV, a lot of these vaccines came from the second platform. And this platform was only possible because when DNA came out, so you can have a sequence and you can make a recombinant protein from them. In the case of vaccine platform one, here you have to grow the whole organism. So if it is a sensitive organism or it is a BSL-3 organism, it takes a huge cost, huge risk to develop this kind of thing. So the ways the science is developing, what is better, the way the product and platforms has to be developed. Then third generation came on adenoviral-based vaccine, and which is now before COVID, one of the vaccine emergency use was Ebola vaccine was approved, and then now COVID-19 from AstraZeneca has been approved. And here what happens that you don't have to make the big fermenters. You have to take a sequence and you have to put in a particular cell and lyse the cells and purify it. But the next, along with this, which is the last platform came out and where we are also party to it. Yes, at present our vaccine is in the review in the final phase. It was a long path for us to develop and work, and still a lot of struggle. But this platform gives the opportunity that this is a pure synthetic platform. So you have a DNA template and you can add certain component into it and in vitro translate. So you don't need even those big manufacturing plant or big bioreactors or those kind of things. But what is the difference between these four platforms? So the fourth platform is, yes, whole organism is important, but there may be certain components which we don't need to give, but its manufacturing is very robust, very risky. The second platform, yes, we have made a recombinant protein, it needs a lot of adjuvant, and you have to build the big facilities, you have to make master cell bank, working cell bank. It's still longer process. But what happened in recombinant vaccine, you have to produce the antigen and you have to give into the body. But in case of adenoviral or DNA-based vaccines, you have to go and you have to give it, and it has to convert into RNA, and then it has to convert into the protein. But here, what advantage mRNA vaccine is bringing, that it is the closest to the virus, and you have to give just a messenger message you have to give, and which will create most natural protein, because the body also produces the virus protein. So this has safest possible way and the highest efficacy, which has been already proven. Now going further into it, there is two things are going to come. the time to manufacture. So manufacturing could be very, very easy. And the process economics, as we develop our reagent and develop all these things, process economics, which is not very, very conducive today, but it is going to become conducive with time, just like we have heard from the previous speaker how the diagnostic kit price has gone down. So this is the vaccine which we have, which is at present in the review. For us, the challenge was, can we create a mRNA vaccine which is 2 to 8 degrees stable? So this was initially funded by the Department of Biotechnology. And now we have completed phase 1, phase 2, and phase 3 trials. And hopefully soon we will hear from the Department of Drug Control of India. It is under review. But I would like to say another thing. This was a very difficult process for us because the people who are reviewing it at different stages, different places, for them, it was absolutely new subject. So a lot of questions come, thousands of questions come, thousands of different kind of thought processes come. So somehow on one side, we have to develop the science in such a fashion, but also we have to adopt with regulation in the similar way. Otherwise, regulatory authorities have a different mindset because we come from a generic business, and how sooner or later we have to also adopt not only at the government level or at the pricing level or at the regulatory level, that what these innovation costs very high and the risk of failures are very high. So this is the way where the Department of Biotechnology is playing a very important role. And going forward, I hope this is going to change the whole course of vaccinology. So why biotechnology is important, I've chosen this to talk about this. Now, the Omicron booster we have already submitted, and we are waiting for approval for start a clinical trial. So this is so quick. The first vaccine took such a long time, but the second version took no time to go into the market. Now, this is the slide I have made, and I want to keep for the students especially. So this is, I feel that it is going to be future of vaccinology mRNA. So which are the area students want to focus into, students want to see, students want to look into it, and also for the researchers. What is, because somebody asked, this conference is post-COVID. So mRNA platform is on the left, and it can be, I can divide it from my thinking into 3 parts. One is that the whole new, because COVID-19 was a low-hanging fruit that has been bought, and it is very nascent technology. So a lot of improvement is possible on mRNA editing side. This is another part, is the whole group we have which work only on mRNA editing side. You can have mRNA self-amplifying, which we have at present, but non-replicating. But we have to see that what are the opportunities come. Then when we synthesize this in a test tube or in a bottle or in a big vessel, the in vitro translation has also a huge opportunity to grow and huge opportunity. This is another such science which has huge possibilities to do the research, to understand it. And next comes the nanolipid preparation. So nanolipid is, where few groups are there, few fights are there, few patents problems are there, all kind of things. But this is a field which is going to evolve very, very heavily. And then stable vaccine formulation, because what took us 7 to 8 months more, we could have taken this vaccine at -70 degrees, but we know this is not deployable, as Professor Ganguly said, that it is not only the vaccine or products should be available, but products should be available at affordable price and it should be deployable. Now, coming on back, what we are trying to do, the backward integration. So this whole plasmid, how we make linear plasmid, this is another science, and where a lot of research is going on, how big you can make. And this could be this is a raw material for this vaccine. So you can make it, you can keep it whenever required, it can go in. There are different enzymes are required. At present, we are buying most of them from outside, but we are working with our partners and internally also, can we produce these most of the enzyme in-house? Because we have to make the self-reliant. When the pandemic comes, a lot of raw materials is not there, different cofactors, lipids, another area of whole biology where we can work on synthesize the different class of lipids which are useful for vaccine delivery. But more than that, for the institute or for the universities, we also have to focus on the disease biology. So what are the optimal antigens and targets? What kind of cell biology is required? What kind of T-cell biology is required? What kind of, as Professor Ganguly said, what kind of correlation of protection for successful tuberculosis vaccine? Correlation, this is the basic science also. So we as industry, we can focus on the technology side, but we might have to go out and collaborate with researchers which are working in the area of disease biology. So this is the whole area which is going to post-COVID is coming up, and people should get interested into it. And these are very exciting areas. But what is going to happening at the vaccine front? So our first generation vaccine is review. Anytime it can come to the outside. But we have also worked and produced the Omicron specific variant. Or we are also working on pan-corona specific thing. And looks like when Omicron came, around 20% of the people who somehow not able to respond against this because of some weakness in their own biology or some system failures. So looks like the third generation vaccine, which is going to come on mRNA base, it will have some T cell per help, where we also were working on that. So this is on the COVID vaccine front, I'd like to say. But also there are a lot of vaccines which are available, but they are not optimum, just like singless herpes zoster vaccine. Today, which vaccine we have, it is hardly 40% effective. The other vaccine, which is 90% effective, it is not available in the country. And after this COVID infection, and most of Professor Ganguly must be knowing very well, a huge barrage of herpes infection has come. So we need to have effective vaccine. Every season you see dengue is a problem. We have some dengue vaccines in the process, but we have to make an effective dengue vaccine. Malaria vaccine has also been developed, but it is only 30 to 40% effective. So these are one of the areas we can say we have an opportunity where we can improve the vaccine. And now coming on the side, novel vaccine, which is tuberculosis day, we have initiated a program in the tuberculosis vaccine. And at present, most of the antigens we have synthesized. Let's see how it comes. But again, we have to see on the left side, what is the B cell biology, what is the C cell biology, whether we have to give to everybody or it's a therapeutic tuberculosis vaccine. And you can imagine that, Professor Ganguly may be remembering, we have started thinking about this maybe a decade back that we have to work with tuberculosis vaccine. Then RSV, this is also a big problem in the young kids. That is the novel vaccine. We feel that here we have a scope to go. And the last one is chikungunya. So we are a company from the developing world, and we also have to focus what is our need for the nation, whether we are fulfilling these our needs. So with these words, I would like to say this is what platform is, what are the opportunities are there, what are the work we are doing, and how the future is going to come. And with these words, I think this is my last slide I'm presenting. So what we expect from all this, what we have presented to you. So mRNA platform is there. The COVID-19 vaccine is improving the existing vaccine. We are looking forward that can we create the facilities here. Again, the central line is very bold. mRNA gigafactories. So if we succeed, we are looking forward, can we create mRNA gigafactories? Can we create national and regional stockpiles of these reagents that anytime if new pandemic comes, we are in position to do it. So I think day for yesterday, I didn't check yesterday, but day for yesterday, the UK new infections were 225,000. And if we convert with our population, it could be 1 crore one day. So this is the kind of the COVID is not going, it is coming in different forms. So we have to prepare for all these things. Then can we develop the technologies which can be easily transferred to manufacture to different places, not only in India, but also outside India? And what kind of deployability we have, that's what we have given you, thermostable vaccine. So if we look on the overall part of the biotechnology, each component of this is connected to biotechnology. And I would like to say biotechnology has a huge future, but we also have to see these modern universities like MIT. We should continuously focus also on the deployability of the technology, what Professor Ganguly said. Deployability of the technology, because basic research is nothing bad, it must be done. But basic research also should have an aim in 3 years or 5 years or something to deliver it. Because young kids which are coming to these universities, they are very bright mind. Research is a very important thing. Research gives the hypothesis, the thinking power, but till you don't translate it, doesn't give you enough beast power, you can say, to do and deliver the things. Because we as a country, we have to go into innovation. We have to develop a self-reliant thought process, and innovation is going to come from the universities. So there is a huge scope where public-private partnership or academic industry relationship. But this is the way when I get the opportunity like this, I come open and I like to talk to the young students, to the thought leader, to the policy leader, what we are doing and how we see the future forward. Now, this is the last slide. This is a unique science. This is a disease agnostic platform. Only you have to change the plasmid, rest of your facilities, your reagent, your lipids, your enzymes, all things are same. So you don't have to change the facilities. You don't have to change the columns. You don't have to, only you have to change the plasmid. So this is a huge disease agnostic platform. And where new variant, when Omicron came, we were asked and we produced the vaccine within 60 days, but still we are moving in between RCGM and DCGI because they feel this is, and again, why I'm saying that we have to go as a scientist, we have to go as a industrialist, and we have to work with the regulators. So if we have to see that we are a vibrant system, not only doing science into universities, not only doing product development into the industry, policymaker has to accept, regulator has to accept. So this is a big ecosystem where I say the biotechnology has a huge opportunity in coming time. And I'm looking towards it, that India is going to be one of the big firepower for providing health solutions through biotechnology. With these words, thank you very much.
Thank you, sir. Thank you for your address and thank you for your time. In spite of your busy schedule, you could make it. Thank you so much, sir. It's my immense pleasure to introduce our guest of honor and keynote speaker, Padma Shri, Professor Syed Hasnain, sir, Honorary Professor and National Chair, Sir, IIT Delhi. Sir is a recipient of Germany's highest civilian award, the Order of Merit from the President of Germany, the only Indian and perhaps only a few persons globally to have received this award. The award is equivalent to India's Bharat Ratna. He is internationally acclaimed for his work on DNA fingerprinting and tuberculosis. Based on his work on Indian basmati rice DNA fingerprinting, India won the case against Pakistan, enabling continued export of basmati to UK, preventing major economic loss to India. Subsequently, Ministry of Commerce, Government of India established CDFD, APEDA, Basmati DNA Analysis Center, where all basmati exports are certified. Sir is an institution builder, policy maker, and a scientist. He is the recipient of PhD from Jawaharlal Nehru University, Delhi. He also holds DSc and D Medical Science degrees. He taught at Delhi University as a lecturer and left for Canada and USA for postdoctoral fellowships. In the year 1987, he joined National Institute of Immunology, an autonomous institute of DVT, Ministry of Science and Technology, Government of India, and in the year 1999, he was selected as the first director, Center for DNA Fingerprinting and Diagnostics, CDFD, a DBT institute. Within 6 years, CDFD.
Can we stop here? Can we stop here? I have another meeting to attend at 11:15.
Okay, sir. Okay.
So,
sir, we welcome you, sir.
Thank you so much.
You can
Go ahead.
with maybe a few more points about Professor Hasnain. So our audience should know, we have large participants. And
do a Google on me, you'll find everything. Do a Wikipedia on me, you'll find everything. Except for
for us. So you can quickly,
Go ahead, Hasnain. I can understand the importance of time.
I'm so sorry. I have another meeting. I already given time.
Sure, go ahead. Go ahead.
I have to, as it is, cut short my talk. But thank you so much for inviting. And I must tell you, begin by thanking the Honorable President. The President has been a strong, we have known each other for a very long time. I think ever since he came back to set up the amity, our relationship goes back to very early. He has been a very good well-wisher and, of course, good friend. We have been, it's wonderful. And anything to do with amity, if I get an invite, I never say no. And here, this is a double bonanza because not only the Honorable President founder president is involved, but also my very good friend Rakesh is involved. And of course, we have here Professor Vinay Sharma, whom I have known for quite some time. And I see a very eminent group of people who have already, you have managed to line up all of them. Thank you so much for inviting me. As I said, I'm extremely sorry if I have to cut down my talk to just about a few minutes because I have scheduled another meeting at 11:15. I thought my talk would be over by 11:05, so I'll have 10 more minutes. I thought it will be an extempore talk, and which is what I thought I would be talking about. And in 20 minutes time given to me, I thought I can just talk to you about the two very intelligent pathogens. One of them has already been talked a lot by Professor N.K. Ganguly, my mentor and well-wisher again, who has given a very thorough background and what is the latest about tuberculosis. He is also aware about our own work. And the other on SARS-CoV-2, of course, the technology part of this, where we are, has been elegantly covered by Dr. Sanjay Singh. So I thought I'll just give a very provocative talk and would be on two very intelligent pathogens, Mycobacterium tuberculosis and SARS coronavirus 2 are challenging human intelligence. And I'll just flag some points, some bullet points to say, how do I, on what basis do I make this claim that they're challenging human intelligence? TB, as Professor Ganguly has already discussed, is very well known. It is the world's largest silent killer. 1/3 of the world is infected. Imagine, 1/3 of the world is infected with tuberculosis. In addition to actively infected, 1/4 of the world is having a latent infection, which means given an opportunity, they can all become active infections. So imagine the depth of its penetration in the world globally, tuberculosis bacterium. And the bacterium that I was mentioning about is known as Mycobacterium tuberculosis, in short, MTB. There is no vaccine except for the BCG vaccine. We have a few candidate vaccines, which we are hoping to get into clinical trials very soon. There are no new drugs. The last two drugs, which were fast-tracked, and this is something COVID has shown us, that if you really want to fast-track, you can fast-track, and you not fast-track, but you can actually do a lightning track. You can do it in a matter of months and not decades, as is the norm for doing vaccine development. No vaccine has ever been marketed before at least 10, 12 years of period of trial. And whereas COVID vaccines have been allowed, although initially as emergency medicine, but now we know the word emergency is being silently removed. It's been given to all over the world, and it has been allowed in a matter of few months. So that is, I think people say we have perhaps fast-tracked it at the cost of efficacy, at the cost of safety. My answer to such people is that you had no option. The only option you had was let people die. And now we know, having taken that decision at the global level, the governments of the day, notably led by the US, to fast-track vaccine manufacturing against and testing and delivery against COVID, how many lives we have saved? Even after vaccination today, and I'll come back to the numbers a little later. So let me come back to the theme of my talk. These two pathogens, the SARS coronavirus 2, interestingly, this virus was known as SARS coronavirus 2, that is severe acute respiratory syndrome. And the name implies that it is something to do with breathing. And now we know it is only partly to do with breathing. This virus has the capability to infect every single cell of the human anatomy. Every single cell, not just the lungs. Why? Because it has been able to access the receptors. It has accessed the housekeeping receptors. Like we have when our offices are closed after office hours, the janitors and others come and clean it. They have a master key that can open every room and enter and do the cleaning. This virus has adopted that master key. Normally, no foreign particle is allowed entry into the cell unless you have a particular gate pass. This virus has taken that gate pass, that's a housekeeping gate pass. So by that token, it can infect every single cell, which means every single organ. And today we are seeing long COVID. This is a new terminology, not a new, it's been there for quite some time now, which simply means you may not see active cases, active symptoms of COVID, but you will see other symptoms. I got infected with Omicron after I had taken both the two shots of Covaxin. Although the symptoms are almost zero, hardly any, I just had a small throat irritation and mild temperature for 1 day. That was 99.9. My oximeter levels were never less than 99. So literally no symptoms, but what normally people measure. But I lost a lot of weight. I lost about 8 kilograms in the process of COVID for 10 days subsequently. I'm recovering, but in the process, I did a good thing to myself. When I went back to my doctor, he told me that I think you don't come back to your 8 kilogram, add just 1 or 2 kilograms if you want to maintain your BMI. So I'm very happy that COVID at least gave me my normal BMI. My BMI is absolutely within normal range. Coming back to COVID mortality, today this virus has infected about 0.5 billion people on the earth. That is 0.5 billion cases of active infections and leading to about 6 million deaths globally. In India, we have about 43 million cases and 0.5 million deaths. In the US, the numbers of cases are much higher for whatever reason. 79 million cases in the US and about 1 million case of deaths in the US, of almost double the case that we have in India. Although India is a very large number. Now that raises two questions. Do we believe the Lancet story that says our numbers are greatly underrepresented? Or do we believe something else that could be happening with our genetics, with our co-infections? I would rather believe something happening with our genetics, something that's happening with our co-infection. India is one of the few countries in the world that has been also vaccinated, as Dr. Ganguly said. BCG vaccine has been given to all children. It works only when you're a child. If you grow beyond a certain age, 12, 14 years, BCG does not work. It will not protect you against TB at all. But what it does, it gives you what we call it as a kind of immunity, which allows it across the board protection. In fact, there are a dozen plus vaccines being tested around the world based on BCG as a vaccine against COVID. Not a vaccine against TB, but also a vaccine against COVID. So I don't know whether the number of deaths or number of incidences are very low is because of a BCG vaccine, also because of a genetic heterogeneity that we have in the Indian population. And that could be one reason. See, the good part with the virus is that we have been able to arrest the virus and arrest it. I will have to arrest it very quickly because of the large number of vaccines. But the virus is evolving so efficiently that with every evolution, it acquires new traits. The Delta variant, for example, it acquired the trait of morbidity and mortality. Largest number of deaths caused were by Delta. In India, almost every family lost at least one person. Suddenly. And now we have the Omicron. And now the latest to happen is the B2 variant of Omicron. And if you look at the Omicron, you'll be surprised to know that the Omicron has more than 100 mutations. And most of the mutations are within the spike protein gene. I'm wondering, is the virus trying to retaliate against the human intelligence? Okay, so you think you'll make a vaccine against me by targeting antibodies against the spike protein? Here is it. Take the spike protein now. Here it is completely mutated. And thereby affecting vaccine efficacy. And not only vaccine efficacy, people are also trying to make diagnostics which will detect the Omicron also. And now the latest variant which has come, B.2 variant, is 50% more efficacious in terms of its ability to transmit than Omicron. In larger cities, cities with 50 million population in China, they have been put under complete lockdown because of the Omicron variant. Places like Hong Kong, Vietnam, North Korea, and many other places, countries in the Asia, they are undergoing a very serious cases of Omicron variant. Even in America, we are seeing much more increased number of cases. And 2 days ago only, the advisor, the big boss in American infectious disease, he has announced that I think we should not think that COVID has gone. It is going to come back. It's already come back with the B.2.2 variant. And my fear, Rakesh, is that with the holy thing that we have allowed, I think we have perhaps, and the virus also has, in mutating the Omicron variant, is not so lethal. Maybe it's a virus's way of saying, if I make it lethal, you guys attack me more lethally and prevent me. So I'll do a very soft kind of a infection. I'll make you morbid. May let you rush to the hospital, but I will not kill you. I don't know, it's a virus intelligence or whatever. But this is where it's a very intelligent pathogen. Concluding with TB, TB is also a very intelligent pathogen. TB infects, as we have heard already 2 lectures. It has learned from us much before we started telling. In fact, we have learned from the TB to stay trim and fit. You know, TB is one bacterium that has shredded much of its gene to become a very thin, very, very, very trim bacteria. The question is, sure, you can trim your gene, but how do you do your major functions? And that is where it has adopted technologies, things which we have never heard of. Things like moonlighting. You know, a Nobel Prize was given for one gene, one enzyme hypothesis, which means every gene will code for one protein, every protein will code for one enzyme, and every enzyme will have one function. Nobel Prize given. And today we know this is absolutely not true. And TB is one great example. One gene can do multiple functions. Not only multiple functions in the same of the protein, but the same protein can adopt and do multiple functions. It has broken the laws of lock and key model of enzyme function. You know, we have been taught in our biochemistry lineage, lock and key model, which means every enzyme has a particular key confirmation in which only that key will get inside. Now we know that's absolutely absurd, because there are intrinsically disordered regions which will allow the protein to fold whatever way it wants depending on what the function is required. So these are some examples. I'm so sorry, I have to conclude now. I have my other, it's already 20. I'm so sorry. But thank you once again. Thank you for inviting me.
Thank you. Wonderful.
Thank you so much, sir. In spite of your busy schedule, you have made it, and we have been able to listen to your words of wisdom. That is more than enough for all of us. Thank you so much, sir. Thanks for your time, sir.
Thank you.
The time is here to unravel the souvenir of BIOCoPE 2022. It truly showcases the hard work of the participants as well as the team behind BIOCoPE. With due permission of all our dignitaries, we would now be releasing our e-souvenir. Rakesh Bhatnagar, sir, do we have your permission, sir?
Go ahead.
Yes.
Go ahead.
Thank you. Thank you, sir. Ladies and gentlemen, presenting before you the e-souvenir of BIOCoPE 2022. I am quickly flipping through
It's okay now, Manisha.
Okay.
Yeah.
Thank you so much, everyone.
Thank you so much, ma'am. So with this, I would now request Dr. Ira Upadhyay, Organizing Secretary, BIOCoPE 2022, propose the vote of thanks.
Thank you, Dr. Ravi. Namaste and good morning to everyone. Honorable Founder President, Vice Chancellor, Pro-Vice Chancellor, distinguished guests, respected deans and directors, and dear participants. On behalf of the organizing committee of the conference, I, Dr. Ira Upadhyay, Organizing Secretary of the conference, feel immense pleasure to propose a vote of thanks. On behalf of AIB fraternity, I would like to thank all the honorable delegates who blessed us with their presence and the valuable time. We wholeheartedly thank our Honorable Founder President, Dr. Ashok K. Chauhan, and Honorable Chancellor, Dr. Asim Chauhan, for their continuous motivation and kind support to us. It is my privilege to propose a vote of thanks to Honorable Professor Nirmal Kumar Ganguly, chief guest of his for his insightful talk about the importance of diagnostic interventions in the post-COVID era. I would like to express my gratitude to Honorable Guest of Honor, Professor Syed E. Hasnain. We enlightened with his keynote talk covering intelligent behavior of two pathogens, Mycobacterium tuberculosis and SARS-CoV-2, and came to know how they challenge the human intelligence. I extend my gratitude to Honorable Guest of Honor, Dr. Sanjay Singh, to grace the occasion. His deliberations related to next generation mRNA vaccine platform technology was insightful. I must mention a deep sense of appreciation for Honorable President Professor Rakesh Bhatnagar and Pro-President Professor Amit Jain for being the driving force behind this event. I also wish to express my gratitude to our Dean Research and Director Professor Vinay Sharma for his constant help and guidance that radiated a source of energy within us. We are extremely grateful to our Registrar, Dr. Nitin Bharadwaj, Director Administration, Finance Officer, who helped in us in obtaining the necessary administrative approval for organizing this event. I would like to thank Dr. IT Cell, Director IT Cell, Mr. Ravi Pachori and his team, Mr. Dr. R.P. Singh, Amazon Administration, and media team for their support and cooperation. Without their efforts, it is impossible to complete this task as in virtual mode. So we have been fortunate enough to be backed by a team of very motivated and dedicated student volunteers who have expressed willingness to take and completion of tasks beyond their comfort zone. As we know, this type of event cannot happen overnight. The wheels start rolling months in advance. I cannot take all the names due to time constraint, but teamwork always leads to a better success. I extend a very special thank to all members of organizing committee, non-teaching staff for their unflinching support and coordination. With these warm words and a kind message, we move to successful completion of this inaugural session of two-day international conference. In the end, thank you all for being with us today. Have a wonderful day ahead. Thank you.
Thank you so much, Dr. Ira. Thank you so much, ma'am. We would also like to thank Professor Dr. Kamalkant Dwivedi, sir, for having graced our occasion. Thank you so much, sir. Thank you so much. Now here I have some important announcements for all our participants, all our delegates. You all, as you all know, that we are having 5 parallel tracks which are running in the conference. So the tracks in which you are in, you have registered for the respective tracks. Kindly, you all are requested to join your respective tracks now. So thank you so much from all of us at Amity Institute of Biotechnology. Thank you so much, everyone, for gracing our occasion. Thank you again, everyone. Thank you.
Thank you, sir.
Thank you.
Thank you so much, everyone.